Okay, so I'm here with Dr. Johnson, and we're going to talk about sleeve surgery and the decision-making process and all that goes into it.
Yes, indeed.
So, I figured that I would ask, like, what were the things that you considered before telling me that sleeve surgery was the best surgery for me?
Yeah, so, the patient's always going to be the ultimate decision maker on what surgery that you do, but it's our job as doctors who do this for a living to help you navigate those waters and make a good decision, and to consider things that you may not have considered. A lot of people come into these surgeries, they've done a lot of research, a lot of people know, I want this one and this is the one I want, and that's usually fine, but at least we need to have a conversation just to be properly informed about everything. And so when people come in, I'm talking to them about their goals with the surgery. What are their main concerns with the surgery? What are their health problems? That's a big one. There are certain medical conditions and diseases that are treated better by some surgeries than others. And so, for some surgeries, like a gastric bypass may treat certain levels of diabetes better than a sleeve does. So if somebody comes in and they're on insulin for diabetes, I may be having a different conversation than somebody who doesn't have diabetes. And the people that have, if they have insulin-dependent diabetes and they still want to do a sleeve, it's not a bad choice, but at least I have to have a conversation about which diseases respond to which surgery is best, and we try to help kind of figure that out based on what surgeries you had, what medical conditions you have, what your goals are. But the sleeve is definitely the most popular, most common surgery for good reason. It's the least invasive, kind of the least changes to your body, and so we make the stomach smaller with that surgery, but it's not really changing the way your body works. Your food's still going in your stomach the same way, food goes out your stomach the same way, your intestines work the same, your colon works the same. So in general, you're absorbing food, medicine, vitamins, minerals, just like you did before. So that's a big deal. So it tends to have the least amount of any kind of vitamin issues or those kind of things down the road.
Okay, so if I had...
The conditions are that the patient comes in and what the goals are, and really try to help them make that decision. In general, all these surgeries are good surgery. They're not like I often describe it like choosing between a BMW and a Mercedes. Mm-hmm. There's some different features. They look a little different. Some people are Mercedes people, some people are BMW people. They're both nice cars. If you have one of those cars, you got a good car, and you're in. So in general, the surgeries, I think a lot of like that too. They're good options. They're in general, all these surgeries are good surgeries. They're going to get good results. But there are certain things about each one that we do try to at least have a discussion of, and then I'll help you figure out which direction you want to go.
Right. So you consider all the variables with that patient.
Right. I think it makes that really just you got to figure out what your end goal here is, and so if somebody's wanting to get off their insulin, that may be a different scenario than somebody who doesn't have to deal with that. When people come in, what are you trying to get out of this? What's your goal? What's your concerns? You're like, I don't want vitamin deficiencies. I don't want to worry about any of those potential things. Well, the sleeve is going to be the right one. So like I said, most people, I'd say nationwide, at least about 80% or so are doing sleeves. And it's for those reasons. It just has, it's kind of the least changes to your body. Your body's still working the same. That's a big deal. So that's, it makes sense for most people.
And then how do you prepare people emotionally and mentally for the surgery? Once they just make the decision, okay, this is the one I'm going to go with, you've considered all the things for that specific patient.
Yep.
How do you prepare them?
Yeah, we really, our program, I think, does a really nice job of getting people prepared. It's so important. This isn't like gallbladder surgery where you just go and do it, and afterwards I'll be like, here's my card, call me if you have any questions or concerns, and good luck with all of the weight loss surgery. Mm-hmm. You're not going to do well if that happens. And there used to be people that did surgery like that, and of course the patients didn't do as well. We were one of the first fields in all of surgery to form centers of excellences where you just had groups of doctors that really concentrated on this surgery specifically, that did a lot of them, and that had good results, and that had just a system set up to make people successful. So that includes doing a lot of education on the front end, making sure you understand what you're getting into, how you're going to, what this looks like afterwards, how am I going to eat, how do I get my nutrition in, what kind of changes do I have to make. And then after the surgery, following you multiple times throughout that first year to make sure that you're making those changes, that you're transitioning to, from liquids to soft food to solid foods. Oh, I can't eat much. What do I eat? How do I, what do I put first? And how do I get my proper nutrition in to make sure I have good energy and also to make sure my weight loss is on track. All that goes into the educational component, and it starts way before that we get to the surgery. The surgery is a step along the journey, but we really try to get you really ready beforehand, fully understand what the surgery is, how it's going to change things. It's a big leap of faith in a lot of ways. It's tough for a lot of people to make that leap, especially at the beginning, and it's off and keep it off for good. It's not a cure, but it's a tool. But it's a tool that works, and so that's part of my job, is to teach how to use that tool and to have a system set up to make it successful. So, some people need psychological counseling or readiness before the surgery. Some people don't need much of that. We just want to get you mentally and physically ready, get you in the best shape we can get you in beforehand, because that's going to just translate to success afterwards. Mm-hmm. So it all starts on that front end.
So basically, you've set a community up of support, a team of support here.
Yeah.
With classes that have to be taken, with you have to get cleared from a psychiatrist first.
Everyone sees a psychiatrist, yep.
Yeah.
Psychologist, yep.
And you have a nutritionist here that follows us and helps us through what to eat, how to eat, and all that. So I think it's a good community that you've kind of set up. It's kind of like you can't really fail unless you just decide not to use any of the things that you set up.
And part of that too is former patients. We have a lot of support groups that people can attend beforehand. It's one thing to hear me say everything. It's another thing to hear somebody who's been through it say it and understand what, it seems a little more real, and it's easier to bounce questions off of people that have been through it already. And so we have a lot of ways to do support groups. We have in-person ones, we have online ones. We have a lot of people in the office that have been through it. We have all kind of people, and it's just a matter of trying to make sure people get what they need to get ready and to be successful.
And how did you come to decide to set it up that way? Like, was it something that you just felt you wanted for your patients, or like how did you decide that was the best approach?
We've, our practice, this is what we do. And so we've been here, I've been here almost 20 years now. This is something that we really, we bought in early to the whole Center of Excellence model and how to be successful with weight loss surgery. And all those steps are needed. I mean, it's like I said, it's not something you see afterwards. We're going to see you 1 week out, 6 weeks out, 3 months out, 6 months out, a year out, and then once a year after that, and that's the minimum. That's provided everything's going great. We have dietitians on staff, but we had to get all that set up because that's how people, there's modeling of that all over the country, and people that do that and go into programs and stay in the programs do way better than people that don't. Mm-hmm. That's one of the problems that people, when they fly to Mexico, for instance, to get their surgery, they don't have that infrastructure and all that stuff to make them successful, and a lot of those people struggle afterwards because they don't have those steps.
Okay. All right, so we're going to switch a little bit, and I'm going to ask about the procedure itself. So tell me a little bit about sleeve surgery, because when I came, I looked at the little picture, and I thought, oh, they're just going to put this little sleeve on my stomach, and, I'm okay with that. That sounds like it's not going to be a big deal, but that's not really what it was.
No, the name is actually horrible. It's very confusing. A lot of people are confused by the it sounds like you have a sleeve. Sounds like it should be something wrapped around the stomach, right? And so, so what we're doing, all of our surgeries are done laparoscopically, and what that means is just we use little tiny incisions, and we with these fiber optic cameras and specialized instruments. And so we were able to, instead of making a big incision, we make multiple little tiny incisions, and that just makes the recovery so much easier. But by doing that, we go into your abdomen, and we have we leave a sleeve of stomach, which is what they call it, a sleeve, but it's basically just a portion of the stomach is left. So the part of the stomach where the food goes in and the part that goes out stay. We don't touch that. But we leave that tube of stomach that's left over, that sleeve of stomach gets left, and all the rest of it gets removed. So we have a stapler. It's a specialized stapler that divides and seals the tissues. And there was a big debate when we first started doing these. How big do we make this sleeve? And you do enough research on this, you'll get into bougie size, and bougie's just the calibration tube that we use when you're asleep to help measure out how big a sleeve to leave. When we first started doing this, we had to decide, all right, how big should we leave your stomach? And we don't want to leave it too big, you won't lose enough weight. We don't leave it too small because you won't be able to eat. And that's a bad thing too. So we need it just right in the middle, right, where you lose weight great and you can still eat. And so there was a big debate about that, 15, 20 years ago, and we tinkered with it, and so we all do it pretty much the same way now, and we have these calibration tubes so we leave just that tube of stomach left, and all the rest gets taken out. It turns out that the stomach doesn't do a whole lot. The jobs of the stomach are to, when we eat food, to grind up to collect it first, to grind it up, and then to make acid to break down the food. The food and the acid go in your intestines, and your intestines is what does all the work. That's where it gets all broken down into carbohydrates and protein and vitamins and minerals and fat and all that stuff that food gets broken down into. So your stomach doesn't absorb anything. It doesn't even really start processing it. It just starts making the acid and grinds it up, and then it goes into the intestine. That's where it gets all, for the most part, gets all broken down. So by taking a bunch of the stomach out, it's easy to see how it's going to work. You're going to feel very, very full now eating a very small amount of food, which is way different than a diet, which is like, hey, go eat this little bit of food and just pretend you're full.
You're right.
So after the surgery, you're going to feel very full eating a very small amount of food because your stomach's way smaller, but your stomach's still doing those 3 jobs that I was telling you a minute ago that the stomach still does all those jobs. It still collects the food, it still grinds it up, and the part that we leave, the bottom part is your antrum. That is where all your acid's made. So it still does all 3 of those jobs. It's just smaller. And so we end up taking that part of your stomach out. But your food still goes in your stomach the same way. Food goes out your stomach the same way. Your intestines work the same. Your colon works the same. So you still absorb vitamins, minerals, nutrients, all that the same. It's just smaller. So generally you're just going to feel so full eating a very small amount of food.
So what are the risks and the benefits of getting sleeve surgery?
Yeah, so this just really it makes the diet part of diet and exercise easy. That's why it works. So you're going to feel very, very full now. I'm changing something about you. People, weight loss in general is tough for a lot of people. It's not like we're all built the same. It'd be nice if we were. And that would mean everybody who's overweight is doing something wrong, and everybody who's not overweight is doing something right. So come on, eat a little bit better and exercise, and we'll lose the weight. That'd be great if that's how it worked, but that's not how it works. Our bodies are different, and some people can eat garbage all day long, and they never gain weight, and they're in general an annoying group of people. Nobody likes those people on that end. And a lot of people are on this end where their bodies are super sensitive to food, very easy to put that weight on, hard to get it off. So I'm taking that group of people that's struggling with weight, because you start looking at how successful diet and exercise programs are. It's terrible when you look at your weight starts getting in that 35, 40 or higher range of what your BMI. To get your weight down to a healthy weight on your own is really, really, really tough. And so what the surgery does is just make it so it's so much easier to do that. You're going to eat a little bit of food and you're going to be full. But what food you eat and how much calories you get in is still up to you. How much exercise you do is up to the patient. And so we're going to teach you, well, you can't eat much. So let's get your protein first, get your vegetables second, and then if you do that, you're full. Now, I can make it so you eat that much food, and you can still put 3,000 calories of food in the palm of my hand and wash it down with a big sweet tea. Are there people that do that? Sure, there are. Do they do as well as somebody who's not doing that? No, of course not. But these surgeries work really well. Most people end up losing about 65 to 70% of their excess weight. So what excess weight is it if you take your weight right now and then look at those crazy ideal body weight scales, and everything left over is excess weight. So if you're supposed to weigh 150 pounds, you weigh 350 pounds, you're about 200 pounds overweight. If so, they'll lose about 70% of that number, 65, 70%. So you lose 140 pounds. And this is where this all gets down to the patients. That's the average. So if you do average with diet and exercise, guess what you do with the weight loss? Average. If you do above average, you're doing better with diet and exercise, then you'll do above average with the weight loss. So you get out of it what you put into it, but God, the weight is just the core problem of so many different issues. And it helps blood pressure, cholesterol, it decreases cancer risk, there's so much heart disease. Even if you never get the heart disease things, most people with weight are gonna get joint pains. It just starts aging you. You start feeling and acting 10 or 15 years older than you are. Yeah. And just be able to get in front of that and get rid of all of that. There's so many health benefits to just getting this weight off. It's a surgery, so you do have to, there's always risk of surgery. Thankfully, the risk of a major complication is extremely low. Mm-hmm. We test it in the operating room. The biggest thing you worry about is a leak. Thankfully, that's well less than 1%. It's rare nowadays. Mm-hmm. We test it. I'm not letting you ever leave that room with a leak. It'll look perfect. I wouldn't stop the case till I thought things looked perfect. But that's why you're on a diet afterwards, to just let things heal. But the leak, we test in the OR to make sure you don't have a leak. You just stick to the diet plan. You should be fine with that. The main risk, really, I think that most people would complain about with the sleeve would be some heartburn. A lot of people get some heartburn, reflux afterwards. Mm-hmm. And so about 15 to 20% of people get a little reflux, get worse reflux afterwards. It tends to be temporary, tends to go away with time. So just get on some reflux medicine in general, and that gets controlled. People love it. People aren't sad they did it. Most people who did it would say, I wish I'd done this 5 years ago.
Yeah, that's exactly how I feel.
But then again, that gets back to that whole thing we were talking about earlier. When you come in someone comes in for their first visit, I'm discussing their risk, and you're trying to weigh that thing of what's the risk of the surgery, and what's the risk of my weight. Because it's not you can't just look at the risk of the surgery. That's something you got to consider. Mm-hmm. But there's usually risk when you're looking into doing this. There's risk of surgery, there's risk of not doing surgery. And those usually aren't even, they're like this. You're so much more likely to have a complication from the weight than you are with the surgery itself. Mm-hmm. And that's what you got to keep telling yourself as you get closer to it, and it gets, I can't believe I'm really doing this. But most people, it really is, it can just be life-changing. There's nothing else out there for weight loss that works like this.
And this has been around for how long?
Well, weight loss surgeries in general have been around since the 1960s. They tried some crazy stuff back then. Mm-hmm. And the sleeve has been around. So the gastric bypass has been around. They really started doing that in the late 60s. And so it's been around, almost 60 years now. The sleeve has been around on a large scale level since about 2009. So they were doing it beforehand, but just in kind of, it was really used as a staged procedure for people that were considered so high risk for a gastric bypass. You do a sleeve on and then do the gastric bypass later. That's how we started looking at doing these 20 years ago. And we were like, a lot of those people didn't want the second surgery, and then we started watching them, and most of them did well. And so then we started offering it to everyone who needed weight loss surgery. We offered it as an option, and most of them did well. And so then in 2009, we started offering it to people on a broad level. And over the next 10 years, it really took off. And now it's, like I said, it went from 1%, so the surgeries done in the United States, to now 80%. And so it's by far the most common, most popular one, just because you don't have just the vitamin issues, I think, is the main reason. You start looking at the pictures of the other surgeries, and the sleeve just looks so much simpler. But It works really well. It's just the people that get themselves again the most trouble are the ones that drink a lot of liquid calories. So it's just you're still responsible for what you do. I can make it so you eat a little bit of food, but especially the liquids just go right through. So you just gotta get off sweet tea, juices, that kind of stuff that just tends to be higher calories. Because people who get the surgery, their body's still very sensitive to food. You still have the desires and everything. Your body is still sensitive. I didn't change that. I just gave you a tool to deal with being, having sensitive. We don't even understand why people. It's not fair and balanced. It's very unfair and unbalanced how our bodies respond to food. We can all eat the same thing for lunch and have different reactions. Our bodies respond differently and absorb food differently. And some people are just on that bad end of the scale where your body, or bad end of that spectrum where your body's just super sensitive to those foods. And so these things just give you a way out of that situation.
So you would probably say you would have to be ready for a lifestyle change with the surgery.
Yeah,
because it's just,
and that's where that education comes in that we talked about. We really try to get you to buy into that. And, because again, I'm not curing anything. I'm just giving you a way to deal with it. And most people do really well with it. And most people keep their weight off long term. You can easily find someone who knew someone who gained their weight back with the surgery. So, that doesn't work. Yeah. Most everyone keeps their weight off, most of it off the long term. But you can find people that didn't. I can show you statistics. It doesn't matter statistics. I can show you 1,000 people what happens. All that matters is what you're doing.
Yeah,
when we get down to a patient, that's all they care about is how do I do well with this?
Yeah.
And this is where you just got to make a commitment. But the diet part is easy now. That's where people, you really got to understand that's what makes it so much easier. That's why it works. Is because I make it so much easier to stick to a reasonable diet. Mm-hmm. And so I want you to enjoy food, holiday meals, cultural foods, things like just smaller portions.
Yep. Okay, so now we're going to change again to post-operative recovery.
Yeah.
All right. So what is the typical recovery time for like a patient like me?
Yeah, so this, most people go home the same day now. We have a lot of our patients are outpatients. They go home the same day. A good percentage stay in the hospital overnight. It really just depends a lot of it on the weight they have going in, their health issues they have going in, varying other factors. But we'll discuss that when you come to it. But most everyone's home within 24 hours. They either go home that day or the next day. Mm-hmm. When you go home, you're walking, you're up and down stairs, you get the bathroom by yourself. But there's still a recovery, still a surgery you're getting over. But most people are mentally, they're good. They're off pain meds in a few days. You're kind of tired afterwards. and so that's what takes a little time to get over. And if people aren't back to work, that's usually why. Most people get off of work about a week to 2 weeks, depending on what your job is. You'll mentally be fine in a few days. I have preachers that are preaching on Sunday after 3 days after their surgery. And so depends on your job and the demands, and I'll help you out with paperwork, whatever you need to, what's appropriate for you to be off for. But I'd say most people are back to most activities. You're driving and doing stuff in about a week, 2 weeks at the most. Now, certainly if you have more manual labor job, you may need 3 or 4 weeks off. But your energy level gets back pretty quick, in a week or so. You're walking that day. People ask me, when can I start walking? I'm like, 1 hour after surgery, we're going to have you up moving around and walking around. So walking's fine, but I don't want you to do any heavy lifting, straining, too heavy exercise until you're about 4 weeks out. The recovery from the diet's about 6 weeks. So, and that just means that you're on that first week, you're just doing liquids. You're on, your body's just healing and letting things heal well. So you're on liquids for about a week, smoothies, protein shakes, that kind of thing. And then, so at 8 days out, 1 week out, you start doing soft food. So now you're doing chicken salad, deli meat, mashed potatoes, eggs. And then about 6 weeks out, you go back to regular food. So there's a healing process for that. Mm-hmm. But during that time, it's really all you want. It's not like you're feeling restricted and you want to jump to regular food at a week out. It's really it's all your body's pretty much ready for. And so the way we advance our diet is usually about all you can handle. It's all you really want.
Right. And how do you manage pain and discomfort?
Well, that's one of the things one of the things we've really learned is how to do that well. That's why we can get people home the same day. There's a lot of things we do, right after surgery. At surgery, we do a lot of blocks to help make to numb up the muscles. So just nerve blocks at surgery. We do, there's all these protocols we have now to limit narcotics, because that makes less nausea, which makes you feel better and get over things. But I need your pain controlled. I need you to be walking. I need you to be deep breathing, doing those things. And so if your pain's not controlled, you can't do those things.
Right.
And so, there's some pain at surgery, there's some discomfort, but it's controlled.
Yeah.
And that's one of the things that before you go home, I need you controlled enough that you can, but it can usually be easily controlled with the steps we do to make sure that, with the pain meds that we need to give you and all the other non-narcotic things we do to try to help limit the pain pills. We want you off of that as soon as possible.
So it's not a lot of, well, when it was me, I didn't have a lot of pain medication. You gave something just in case, but I don't think I ever had like a whole lot of extreme pain.
Some people, everyone's response is a little different with that, and so some people are off of it. Some people never take a dose of the stuff I give them.
Yeah.
Other people use all of it, and they need to, but I'd say most people, they need it for a day or two. You're functional. You don't feel perfect, but it's well controlled. It's very, again, you're walking around doing stuff. You can go watch, you can go just do walking in your place, or you can go to, I've had people like, I just want to go watch my son's football game tomorrow. I'm like, oh, you can go, just take it, just don't drive if you're taking the pain meds, but just, you can go, you can go do stuff. You'll mentally be fine. But it's well controlled, and you're usually off all that stuff in just a few days.
And so, so one thing that was challenging for me when I had my surgery was I felt fatigued after a couple of days. And so you told me about the IV places to go to, and I had never heard, I didn't know that they were around or anything like that. So is that something that you would typically recommend, is instead of going to the emergency room, I feel fatigued, I'm dizzy, I don't know what to do, to just go to one of the IV places?
Yeah, that's a great, so, one of the things right after surgery, there's swelling, and everyone swells at different rates, and so some people have more trouble keeping up with their fluids that for those first few days than others. That's one of the things we do before we let you go home, is make sure you keep stuff down. But sometimes you do that over a few days, you're just getting a little behind. They have all these these hydration station kind of type of IV centers where you just go and get some IV fluids and go home. And if you're doing fine, otherwise you just feel like you're down a little bit on fluids, it's a great way to catch up quickly without having to go sit in an ER. And they're all over the city, all over various areas, and so I think it's a great way to just get you caught back up. Fatigue is, like I said, that's the most common complaint that first week or so afterwards. It can be from dehydration if you're not getting enough fluids in. It can be because you're not eating that much, because you're just getting that diet down. That's why we got you on these protein shakes, and as soon as you get your protein up and your fluids up, that fatigue goes away. And so most people are back to doing a full-time job at a week out, but those first few days can be, that's the number one complaint I'd say of people those first few days, just feeling a little wiped out. So we're watching urine output. If you start feeling dizzy, lightheaded, your urine's getting dark and more concentrated, and getting a little IV fluids will put the pep back in your step for sure.
Okay, and so now we're going to move to long-term results and lifestyle changes.
Yep.
Okay, so what do you feel are the benefits? But we kind of already went over that. And how can I prevent from gaining the weight back,
right,
and complications?
Yeah, so thankfully complications long term they're pretty low especially with the sleeve. You don't see much at all beyond just weight regain is obviously something that we try to avoid, and that's part of just staying in the program. But you have to make, like I was saying earlier, you have to make a commitment to a healthy lifestyle. A lot of what we try to do that first year is not to put you on some specialized diet. These are lifestyle habits that you need to develop. We're gonna, just keep encouraging you and watching things, and you don't want to stretch out your sleeve. People in general worry about that, and that can happen. And so we're always kind of really encouraging that when you're full, stop eating as the finish our plate mentality got a lot of people in trouble. That's how I grew up, and there was starving people, so you don't want to waste food, but you don't have to eat your whole plate, especially as time goes on. Our plates, you go out to dinner and the portion size just kept getting bigger and bigger and bigger. And there's no way to finish these meals. Take it home, it's fine. You don't have to waste it and just bring it home with you. So just when you're full, you stop eating. I'd say the biggest concern of why people would put back on weight is because they start altering what they're eating. It's not so much you're eating more, it's more that you're eating the wrong choices, and people figure out, well, if I eat slowly, I can get a lot of this, whatever it is in, and all of a sudden their calories are starting to go back up. And so it's really just a matter of just trying to stay on a good lifestyle, stay, good healthy eating habits, good exercise routine. And you do that, you're gonna be fine. And the people that struggle are usually the ones that I never see again, and then they pop back into clinic 5 years later, and like, I didn't want to come back in. I was putting on some weight, and I'm like, that's the worst thing you can do. I don't yell at anyone. I'm here to encourage and to help. And so we want you, if you're putting on weight, come back in. That's what we want you to do. We've got dietitians on staff. We got so many different things we can do to help you get back on track and get the weight back off. We'd rather you come in earlier, but whenever you decide you want to come in, do it. That's what we're here to do. We're here to help.
So it's fixable.
It's fixable, but it's a lot of the at that point the onus is on the patient as well to make good habits. But whatever you're struggling, let us know. But if you stay plugged in, you should in general do really well.
Okay, so now we're going to talk about addressing concerns and myths, because I'm sure every patient has come in here and said, my family member said XYZ about my surgery. They feel like, so what are some of the common misconceptions of the sleeve surgery that you've heard?
Yeah, I think the biggest one would be is I knew someone who gained the weight back. That doesn't work. And it's, you read this is going to happen. You don't want to do that. So I think, you can go and find find anything bad that happened on the internet, and can those things happen? Yeah, sure, of course you found on the internet, and sure, internet's always true, right? But in general, things can happen.
Yeah.
But there's, again, you're just that whole thing you're trying to weigh. What's the risk of the surgery? What's the risk of my weight? What are the success rates? What are the overall? You start looking at, well, what did one person do? They gain their weight back. Well, there's a lot of things that could be reasons for that. It could be something with the surgery that's not working well anymore. It could be the patient's fault. It could be the doctors who did the surgery didn't do something right or whatever. There's a lot of reasons why someone may regain weight. But to just say it just doesn't work, there's nothing out there that works better than this. But it's not against. So it's a big decision. But there's just people are going to say what they're going to say, and you just got to worry about yourself sometimes.
That's true. So you answered like the last question that I was going to ask. What advice would you have for somebody considering sleeve surgery? You kind of.
Yeah, I think I'm fine. You should do your research. I want you to do your research. Talk to one of us about it. You're not signing up for surgery when you come in here. We're just having a conversation. I got some people that come in and they got their whole packet ready, all their papers done, and they're like, what do they want? And they're like, let's go Thursday. And other people come in like, I'm just getting information today. I don't know if I want to do anything. Yeah. And everywhere in between, we got everyone. And so we're not gonna push into anything you're not ready for. I actually need you to be ready to do surgery, to do well with the surgery. If you're not ready, I'd rather you take your time. Let's go through some other options we may have for weight loss. We'll discuss all the options that we can do to maybe help you out. And when you're ready, you're ready. And I've had people drop out, come see me again a year later or whatever, and they're kind of spun their wheels for another year. Now they're ready to go, but they're mentally now they're in a better spot that they'll be successful with it all. So, it just come in, get educated, make sure that you understand, what the options are, and then talk to a professional about it, and they can go over things in a lot more detail. And then when you make the decision, just don't look back.
Okay. So, is there anything else you think would be important to let people know? Because that's all the questions that I have, and I think this was really informative.
Well, people always, it's the normal kind of worry and especially as you get right to surgery, do I need to do this or not? almost anyone who ever had it done would say it's the best thing I ever did. I wish why did I wait so long? I wish I'd done this 5 years ago.
Yeah, that's true.
And it's liberating. You don't. Sometimes I have people come in like, I'm healthy, I'm just overweight. I'm like, you don't even realize what the weight's doing. And sometimes until you get it off, you really don't know.
Mm-hmm.
But weight's going to age you. You're going to just start, even if you are healthy right now,
Mm-hmm.
you're barreling towards a bad path. And so you just want to, it's good if you can head it off before you start getting health problems. We do a lot of patients that we're trying to get them, get their risk factors down and get them in better shape to do damage control, so to speak. Mm-hmm. And it's even better to be preventative. And so if you can get ahead of it and before you start getting permanent damage to your body from joint pains or whatever else that the weight can cause, heart issues, you want to try to avoid that. So an ounce of prevention is good.
It's hard to see that in the beginning
Mm-hmm.
because before I came, I thought, oh, I look good or whatever. And it was my husband that kept saying, I think, do you want to lose some weight? Do you think you want to lose some weight? And the doctors were saying that
Right.
to me too, but I couldn't see it. And I couldn't even see it when the weight came off either, that the weight was coming off until a family member took a picture of me.
Mm-hmm.
And I looked at the picture and I was like, who was that?
Yeah.
So I think it's a perspective kind of thing.
It
You
is.
don't really see it.
It comes on so slowly that you don't notice the drastic changes. I see that a lot where I have people who will take a group photo and they can't find themselves in the photo for a while. A lot of the weight loss, especially those first 3 to 6 months, it's fast. And your mind's almost not catching up with the new you.
Mm-hmm.
That you still go into the department store and go to the larger section. It's just your body. It takes your mind a while to start resetting itself.
Yeah.
And those are normal kind of things. But that you're feeling so much better that whole time, and you're so much healthier.
Mm-hmm.
And it's
The end result. I wouldn't change a thing.
Yeah.
And I can't thank you enough.
Well, it's my pleasure. I've enjoyed watching your journey, and you've done phenomenal. So.
All right.
All right.
Well, thank you for
You
your
bet.
time.
Thank you very much. Thank you.